Welcome to the Healthing Podcast. I am Ushma, founder of Rypple.
And I'm Thomas Plochg, Director of the Federation for Health in the Netherlands.
Ever feel like staying healthy is just too hard? Like the system is set up to make it more difficult than it should be?
You're not alone. Our health systems focus on treating disease, not preventing it, and our environments, from food to air to work, often make it worse.
In this podcast, we'll explore how to make healthing easy and accessible for everybody.
Together, we'll uncover how to build systems that prioritize well-being, not just profits.
So whether you're a policymaker, a health professional, or just passionate about a healthier world,
Healthing is for you. Join us.
Welcome everybody to the Healthing Podcast. We're really excited to have you with us today, listening in to Thomas and I, and our very, very special guest. Today we are really happy to have Dylan Power with us. He's a senior researcher at the Urban Cycling Institute in Amsterdam, in the Netherlands. He has a very fascinating background in Ireland and Spain, and has led various international projects as well. So he brings a very unique global perspective to our discussion. Let's start the conversation off. Dylan, could you tell us a little bit more about yourself?
Yeah, of course. Thanks, Thomas and Ushma, for the invitation. Yeah, my name is Dylan. I'm from Waterford in Ireland, but I'm currently based in Valencia in Spain. And I'm, as Ushma said, I'm a senior researcher at the Urban Cycling Institute. So we're a non-profit organisation that are based in Amsterdam, but have a global reach. And we work on research, training and events related to urban cycling, active mobility, and also physical activity, public health as well. My own background, I studied sport and recreation at the undergraduate level, and worked a lot in recreation programming for people with disabilities, kids and adults with intellectual disabilities. And then after a year out after my undergrad, I went back to do a PhD in active travel promotion and systems thinking. So my PhD research was conducted in Ireland, and I worked with the National Walking Promotion Organisation and one local government to develop a systems approach to the promotion of walking, with the intention of scaling that up across different cities. So that was back in 2023 when I finished that. And between working at the Urban Cycling Institute and then I did some work with the University of Limerick in Ireland to develop the physical activity policy guidelines. So I would say my background and my research career to date has been quite practice and policy oriented, and have been very lucky to be kind of in a pragmatic role in a lot of the jobs and the research roles I've been in to date.
Oh, great. Thanks for the introduction. A lot of topics that we can discuss about. As you know, we are in the podcast on healthing. And yeah, we invited you to come in our podcast. And as we explained, healthing is a verb. Health is not static, but you have to earn it every day by interacting with your environment. So my first question would be, can you reflect a bit on healthing? Because you are willing to be here, but of course you have an idea what healthing is about. So we are curious how you look at the topic of that theme.
Yeah, when I got the invitation from you guys, I suppose I hadn't actually come across the verb healthing, so it was nice to read it and like to hear about that.
We still have to coin it, huh?
Yeah, trademark it. But no, I think it's a fascinating idea, because a lot of, as I said, the work that I've been involved in has been with different stakeholders and different disciplines. And yes, it's been around health behavior change, but the process of arising at more people walking or more people cycling or more people being physically active goes beyond just health programming or doing health exercise or health oriented programming around exercise and things like that. So I find your approach and the topics that you're interested in quite fascinating and quite big picture thinking. So no, I was delighted to come on.
To me, it's not a surprise. While your background in research, and you do systems thinking, complexity science. So when you actually, my opinion is, but I don't know, Ushma, you agree, of course, is that healthing is complexity science based. It's more ecological thinking that's underpinning it. So to me, it's not a surprise that you're saying that you feel comfortable with it. So that will be also a question to you, because can you give you some more going deeper on the relationship between the systems thinking, your PhD research, and healthing, and how it relates? Because I think what now maybe the other angle would be, what are the core take-home messages of your PhD, and how does it relate to healthing then?
Yeah, so maybe just to preface, so my PhD was funded by the National Walking Organisation in Ireland, Get Ireland Walking, and we worked in Cork, which is one city in the south, on the south coast of Ireland. And what we wanted to do was develop kind of a framework by which local governments could recruit, engage, and work with stakeholders from different disciplines, while walking and active travel being the main focus. So given that I was kind of embedded within an organization, but also in a university, in a PhD student position, I was kind of forced to be, I felt like I had to be quite pragmatic in terms of what frameworks and theories and ways of thinking that I brought into the organization.
Was there not a tension with your university then?
So there was, but I was lucky that my two supervisors, Professor Niamh Murphy and Dr. Barry Lamb, they were quite pragmatic researchers, and so one thing they would constantly ask me when I would come with the idea for complexity theory, or this framework and that method, so what? That's what they would constantly ask me. What does it mean for the local government? What does it mean for Get Ireland Walking, the organisation that I was involved in? And I think that was kind of at the core of my entire approach of my PhD, and to be honest, still is now at the Urban Cycling Institute in the work that I'm doing, is that yes, we want to be multidisciplinary and kind of systems oriented and lean on the theories and the ways of thinking and the methodologies that have come from systems and system science, but be pragmatic about it. How can we actually bring it to practice and policy? And that's what I find really interesting. And I think we spoke about it the last time, Thomas, that the kind of trajectory of system science and complexity science from its origins in the 1940s or so in mathematics and economics and all of these fields, and now we're at a point where I'm trying to apply it to urban cycling in Bonaire in the Caribbean, or physical activity promotion in a city in Ireland.
How do you do that? Because I'm also a scientist and also a system thinker, and I'm always getting the how do you say that? They say to me, Thomas, you're far too abstract. It's so complex, theoretical. It's academic. Please explain. Make it more concrete. Make it more practical. Well, that's seriously difficult in my experience, because you can only be, when you apply system thinking, you have to do it, and during the way you're learning what it means in practice. So there's always a sort of catch-22 behind it, and I experience it as a dilemma, as a duality. So my question is, how were you able? So you were lucky with your supervisors; they were practical researchers, as I might say so. But you were actually challenged to balance that in a good way, or how would I say it?
Yeah,
would you say, yeah?
It is a challenge for sure. But one thing that I would say helped kind of balance that is not trying to reinvent a wheel. I think researchers are trying to be novel, and of course trying to publish new work, etc., etc. But there are a lot of useful frameworks and good work that has been done already that you can lean on to help kind of streamline the process of introducing the concept of systems thinking to a group of stakeholders who might not have ever come across it or had ever worked with it. So two things that we used were the United Nations Sustainable Development Goals and the Global Action Plan for Physical Activity from the World Health Organization. The latter, the Global Action Plan for Physical Activity, that was based on and was developed by a team of researchers who came from epidemiology, physical activity, physiology, but also from systems and complexity science. And using tools like that, like the SDGs and like the GAPA, I think, who come from reputable organizations, people, the United Nations and the World Health Organization, can help, at least at the beginning, frame a conversation amongst multidisciplinary stakeholders from a systems perspective and kind of get people thinking big picture, or at least help stakeholders situate their work within the context of a broader system. I think that's going to be the constant challenge as we learn how to apply systems thinking and systems science in pragmatic work related to mobility or physical activity or obesity or whatever it is. But I think not reinventing the wheel can help streamline the process. Not trying to reinvent the wheel can help streamline that process. But that's one thing that I leaned on in my PhD, and is kind of I'm kind of leaning on now, is trying to stand.
So those theories or things help you to enter into the conversation with municipalities in Ireland.
Yeah,
to get the mobility issue on the agenda, but also to look at more from an integral, interdisciplinary way of approaching it, isn't it?
Exactly.
And then you take it from there. But what are you doing then concretely? Because that's maybe that our listeners like to know. What does that mean in practice then?
So in relation to my PhD work, for example, we used systems mapping, and the idea of mapping out the interventions that are happening in that particular system, which was in Cork related to walking and active travel, and using that to identify gaps. But in an ideal world with budget and time and everything, you would start with a blank canvas and really work with stakeholders to develop their idea of what the system looks like from their perspective. And I think with kind of using previous frameworks, which we did, the Global Action Plan for Physical Activity, applying that to their context and looking at the different actions that are outlined in that, and they have kind of a nice visualization of the physical activity system and the different areas. But rather than starting with a blank canvas, which would be ideal, in most scenarios in relation to systems mapping, applying that, using that as a kind of backdrop to their context and allowing them to fill it in was kind of us trying to be as savvy with time and frameworks and stuff as possible. In an ideal world, as I said, I would have liked to do things like group model building and develop causal loop diagrams, etc. But it was it was part of a PhD project. I was working with an organization. I think we learned a lot from it.
Yeah, well, yeah, you learned a lot. So what were the lessons and what was your impact?
Well, where we're at now in Cork is, Cork is the city that I'm talking about. Cork have now developed an action plan for walking and active travel based on the actions and the quadrants that are outlined in the Global Action Plan for Physical Activity. So we have come from a series of workshops that were kind of underpinned by the application of this framework to the context of Cork, to now to now having an action plan. Excuse me. So I think that process allowed us to. It helped us jump a few steps. I think having the actions, having or at least the categories in which actions would fit, but applying it to their context, I think. So that was the biggest lesson for us, is that the Global Action Plan in that context, in that scenario, for that research project, was quite a useful tool to help base the development of an action plan on.
Is that the advice that you would then also give to other cities? If we just think about how health is such a central part, how walking and cycling or mobility is such a central part of healthing as well, is that kind of the approach that you would give to other cities? And maybe to add on, what would you say are the biggest obstacles to why this is currently not being adapted very much in other cities?
Yeah, I think in relation to the first part of that question, in the publication of the Global Action Plan for Physical Activity that the World Health Organization put out, it's encouraged for local governments and local level systems to kind of pick it up and run with it and adapt it to their context. So I would say it was quite useful for us. I think it could be useful in other contexts as well. And then in relation to the second part of your question, the barriers.
Wait. So actually you're saying you have to contextualize. That's the thing what you have to do. So you as a researcher, as a PhD student, or in New York, you took the WHO guidelines, and you contextualized it to the local context, and that meant that in Cork they were able to make really practical actions out of it. And you guided that, or you helped with it. So I'm a Dutchman. So if I go to Cork now, and I want to, as a tourist, so I will see that there is more possibility for me to have a nice hike or a trek, which is created by your initiative, or what can I see then?
I won't take credit for people walking on the streets in Cork for my PhD. I definitely won't take credit. But
no, you don't want. No.
I suppose the way it's broken down in the framework, which I really liked, was there was 4 kind of quadrants or 4 areas. There was active people, active societies, active environments, and active systems. And what we found in the initial phases of the systems mapping process in Cork was that active people, which had kind of action points related to individual level interventions. So it could be community-based programs, it could be like hiking programs, hiking groups, things like that. That was really well developed in Cork. So there was lots of really good interventions happening in this active people quadrant or area of the system, let's say. What we identified then in the process as well was that active systems and active environments, which could be things like governance processes, data systems, indicators for measurement, policies, environment, things like that, they were quite, like, there was not a lot going on, I suppose, in those areas. But I don't think that's specific to Cork. I think that could be,
no.
That's broad, that could be applied at the broad level. So over the course of the PhD project, we worked with the organizations there to, within their resources, within their capacity, to develop actions and interventions that could address the gaps. So one of them was that there was no platform or no kind of group that allowed for conversation and collaboration across sectors within the local government there, and with local residents and other advocacy groups. So one key action that I can think of at the top of my head now, coming from that action plan development, was the development of the Get Cork Walking Steering Committee, which involved local government, chaired by the kind of local sports partnership there, and has a range of other stakeholders there.
So you create a podium for the health and all policies to be discussed within the system, and yeah. Okay.
It was a gap that we identified, and it was kind of, I know it was specific to that context, but I think it could be applicable in others too,
Yeah, because that was the question of Ushma. Because what can other cities learn from it? You're now in other cities, and eventually you might have other take-home messages, or the contextualization delivers other ideas that you have to do, isn't it?
Yeah, and Ushma, am I right in saying that your question was like about the kind of barriers from shifting away from? Okay, yeah, like, I think that's hard, isn't it? Because the kind of car-centric cities and walking and cycling is not the status quo in majority of cases.
No.
And it's, it's easy for other cities to just copy and paste what the status quo is, and I think that's our job as researchers who are kind of operating at the policy practice border at that kind of point to keep fighting that fight. And look, it's hard, but yeah, I think one of the biggest barrier that I've come across, and this is kind of applicable in a lot of contexts, is that, like, the work packages and the programs of work and people's job description may not even have opportunity or flexibility for this to kind of engage in this type of work and engage in systems approaches or multidisciplinary collaboration that might be happening within their city. So I think that's kind of the biggest barrier that I have come across in my.
So,
Okay.
so in a way, like big companies need to be mobilized to prioritize health as an outcome. Do you think health is undervalued as an outcome? And
Yeah.
or not?
Yeah, no, yeah, that's not a question, because I was thinking what Dylan was saying at the last was very interesting, in the sense that the function description of his job does not allow people to really be pragmatic, and maybe that's a really important thing to change the functions of people. That's what you were saying, isn't it? You know, if we lock up people in their offices because their job descriptions are saying that they have to work from there, then you never get the transition as we really would love to see, isn't it?
Yeah, and I think like maybe this is to both of your questions. Like it's not their fault. You know, people are doing their jobs and people are working within the.
Is it not their fault?
Well, I think people are working within their job descriptions, and I think like it's hard to point
But
the finger.
why aren't you? Why are you able not to do it? Or why, Ushma, you are not also in a job description? You freed yourself as well, and I did it too. So why do we it and other people don't?
Are you asking me about my job or just the job of?
Oh, yeah, maybe. Yeah, that was my initial idea. You know, you worked in university, and eventually you're lucky with having two promoters that are giving you the freedom to be pragmatic and to stay not fixed in your box. And then now you're working at a private research institute,
I
and
mean,
that
maybe
allows you to do the same. But in my explanation, Ushma, you want to tap in?
yeah, I mean, maybe the question is more, who is the problem owner of the work environment? Is it the company's boss that determines what is the work environment of all the employees? And if
Maybe,
health is a
yeah.
priority of the work environment for the boss, then he will make sure that, you know, we have regular breaks, we make sure that we're in a location where people can walk to work, or, you know, those kind of things. Who is the problem owner
Maybe
of
you should
health within a
elaborate
working environment? Yeah.
Ushma, maybe you should tell a bit about how you abandoned your work in Singapore, because that was actually the reason that you started Rypple, isn't it?
Yes, but it's I mean,
I don't
for
know
me,
whether Dylan knows.
yeah. So I was had a 10-year career in the corporate world, and I left the corporate world because I felt a so it was more content wise. I felt a misalignment between my values of how a health system is led sustainably and the way the reality of the healthcare system or my role in the healthcare system was. So I was selling medical devices to patients, and I felt bad, honestly, like it's a moral issue that I felt bad earning money from people that are sick. So I felt a misalignment there between what the system wants, which is to kind of manage diseases and make money off of it, and what the patient, or not the patient, the person or the individual should want, which is all around healthing, right? So that's why I abandoned it, not so much because of the work environment. I think with COVID, even my company had a lot of initiatives to support mental health, but also support physical activity. And Singapore is also a very health conscious country. So they have a lot of, they're very proud of their park network, where you can go from very easily from one park to the next park. So I think from a healthy environment there, I think in the corporate world, my company did a good job. But the question I think kind of is, who is the problem? I think that's a question I come across quite commonly when thinking about complexity science and systems thinking, is who takes responsibility for an issue. If it is so complex, we have healthing, it includes mobility, it includes the food system, it includes healthcare, it includes the air, it includes water quality. We have so many interactions and so many systems that are involved in just healthing. Who then says, okay, if we have a problem with healthing, I'm going to solve it? Who is that?
That's a great question. Yeah, I don't know the answer to that question, but I think, like as you pointed out, if we're talking about, let's say, physical inactivity as a kind of
Mhm.
complex societal problem,
Mhm.
there are individual level factors that influence it, environmental, policy level factors, physiological factors that influence physical inactivity or obesity or whatever we're talking about. And I think population levels of physical inactivity or obesity are not a result of just one or two of these factors. I think it's it's a mix. It's a kind of it's a mixture of all of them. And like I think this is why we found ourselves in a position now where in physical activity and health research we are looking towards system science and complexity science as a potential solution to the problems that we faced or we are facing in the kind of research space, because I suppose what we're seeing is that publications of physical activity research are going up and up and up, but also physical inactivity levels are rising. And so are non-communicable disease rates in some areas too. So I think part of the argument that is being put forward for that is that we're relying on this kind of individual level approach to health behavior change, running programs and things like that, which are great and which are needed, but also these interventions and stuff don't happen in isolation. So again, this is why I think we're leaning towards and looking towards and adapting methods and ways of working from these fields and applying them to public health and physical activity and so on, which I think is super fascinating. But to answer your question, who is responsible? I don't know.
Could it be? I might have an answer. Could it be that when you that's how I experience it. When you apply system thinking or complexity thinking, you make it really practical. What you actually do is continuously syncing yourself with the changing context. So contextualization is really important. And then you have your broad view, so you observe all those interactions, and then you might learn where what you say the weakness points are, or the blindfold fields, or and then you can sense where's the energy, or where's the need for it at this moment, is this stage, in this changing context. We need now to have that podium for other people to discuss with each other the issues on system thinking. So when you are in sync, then you know who's responsible at that moment, at that time, in that context, and then you should act for it. So that would my suggestion be, and that boils down again back to the job description, because eventually maybe the question would be, is it this what you are actually doing implicitly, that you say, okay, that's what I try to do. I'm syncing myself with the context where I do my research. And by doing that, I sense where the opportunities are, or where the biggest hurdles or the biggest challenges where we should to focus on. And when you get energy there, then the one is taking responsibility, isn't it? Could that be how it actually works in
Yeah,
practice?
I actually really like that way of putting it, that like syncing with the local context. And like say in my own role, in my own context, I work, like a couple of the projects I have are based in the United States, in the Caribbean, and here in Europe. And I can't be in these places all the time. I don't know the context. I don't know the ways of working and the norms, etc. So I think for me, and I think it's a kind of a useful thing to do in this type of kind of community-based action research projects like what I'm working on, is really, really rely on the expertise of the local people, or the local residents, or the local stakeholders. And to your point, Thomas, I think like that will help you sync with the context, because in the main project that I'm working on at the moment, which is in Bonaire in the Dutch Caribbean island, um, that's a context that I have never worked in before, but like a super, super interesting context. Small island, 25,000 people, 20,000 cars, multiple different language spoken, Papiamento, Dutch, English, Spanish, um, different rhythms of working, different ways of working. And I think because I'm not there, all I can do is rely on the local people to relay it back to me, and working closely with them. And I think that's it's not just in that project, but in other projects that I'm involved in and have been involved in as well. I think if you kind of act as this researcher who drops in, does their research, writes the report, and leaves, I don't think you're contributing to systems change. You know, I think, like as you said, adapting to the context, understanding it a little bit more can help really create meaningful impact. Sorry, Thomas, you're on mute.
Well, my problem is my phone is ringing, so that's not a good idea.
Okay.
Oh, it ends. So sorry. That's also happening. No, right, but that brings me back to your point of the job description, because you eventually to be able to sync yourself, you may be a little bit you're not stuck into the you need to have a job description or a place at work where you are allowed to explore other ways, isn't it? And you need some discretionary freedom to do it. That was actually your point that you made earlier, isn't it?
Mm-hmm. And I think, like, we have one example of that in Bonaire. So, you know, like, I'm leading the project, yes, but I'm not the only person. We've a team of people working on it,
Mm-hmm.
which is really helpful. And one person in particular, Rita Khemerts, she's actually on Bonaire at the moment as a kind of embedded researcher for us at the Urban Cycling Institute.
Yeah.
And she's there for 6 months this time. So in her description of work and program of work is to, it has the flexibility, you know, to engage with local people and meet and connect stakeholders and kind of act as that middleman that, you know, oftentimes that work goes unnoticed, I think, but it's so important for the residents of Bonaire and the people on the island to realize that it's not just me and, you know, and like we need in this, especially in a context like Bonaire, like a white English speaking man traveling with a team of researchers to Bonaire. I think there is a history on the island of that things like that don't sit so well, and I think it's important to kind of sync yourself with the local context, as you said, Thomas, and Rita is a huge part in that. But as the point about the job description, she has the flexibility, and that's kind of part of her role, which is to build the network and kind of represent the research on the island with the local people, and it's been invaluable to us.
What do you think are like, based on your experience now from Bonaire, what are the most difficult or like what are the biggest barriers of understanding local context? I mean, people talk about a lot of things lost in translation, but sometimes local contexts are also a lot of implicit things, right? Like things that are so natural to us that if you ask me, you know, how do we help? We might not even consider a certain aspect as health or as helping, right? So there are a lot of implicit things. Yeah. What are the barriers?
So maybe just to give a bit of context, like the project is for 4 years, and I suppose what the ultimate aim of the project, by 2028, we'll have a set of policy recommendations for active mobility for the island of Bonaire. And I suppose we've been trying to make it with Rita involved and with the kind of approaches that we're taking. You know, it's for Bonaire, by Bonaire, and that the stakeholders and residents and community groups will inform us, the researchers and the local government, about what should be involved in the policy making process and the decision making process as time goes on. But one of the really interesting things like that we found in our initial research was last year, the first year of the project, was kind of all about just understanding, really putting an emphasis into understanding the context, speaking with as many people as possible, introducing the research project, and understanding kind of we ran surveys and observations and things like that. But one of the interviewees told us we need to de-Dutch the bicycle. The image of you know, the upright bicycle in Amsterdam that you'd see on photos or when you're there and whatever, that is not what cycling looks like, feels like, and is for people who live on the island. And I think that's like, it was kind of said in passing, but I think it's such an important point that if I try to copy and paste interventions or things that have been shown to work in the Netherlands context to Bonaire without being sensitive to the context, it's not going to work. And I think that's part of what we're trying to do with our project is to really understand what does cycling look and feel like for those on the island, because it's also what we learned is that it's almost an inability to imagine anything different than what is the status quo at the minute. So working with community groups and stakeholders to actually imagine what that might look like is another kind of task that we have for this year and next year.
And do you have a glimpse of that already? What's the image emerging of Bonairean cycling or walking, not in a detached way? So
well, I think that's not for me to say. It's for
why
the
not?
people. I don't.
Imagining,
Yeah, I think I was lucky enough to travel there last March, and to kind of experience it firsthand and cycling around. It is quite unsafe. There is no cycling infrastructure there. There is no walking infrastructure there. But what's interesting is like some of the other barriers that you would commonly see in other cities, maybe like it's very hilly or it's very big. Bonaire is very small. The kind of main town, Kralendijk, is quite flat, and yes, it's humid and hot, but the weather is not it's not super bad. So some of the other barriers that you would see are not there. And interestingly enough, we did some like GIS analysis as well, and what we found was that 2/3 of the population of Bonaire live within a 5-minute cycle or a 5-minute cycle or a 10-minute walk from supermarkets, bars, restaurants, pharmacies, everything that they need. So geographical proximity to services is not a barrier either. So as I said at the beginning, it's like a super, super interesting context, and trying to kind of work with the local stakeholders and residents and government to figure out what it looks like, what the cycling looks like.
If I go to Bonaire, yeah.
I mean, you're eliminating barrier after barrier after barrier. Then the question, of course, is like, what is then? Why is it?
I just figure out, when I go one time to Bonaire and we land there at the airport, and we don't get a cab, but we rent a bike.
And like it is super close to everything, the airport too. So
So why was that the case? So I think what you're saying, and that's also maybe a little bit to go to the final question, because we're already talking already 3/4 of an hour. It's a cultural thing, isn't it?
Yeah, it is.
Cultural or contextual, or
I think cultural. Like there is almost a 1-to-1 ratio between cars and people there, but also there's this kind of and this is not specific to Bonaire, but the stigma around the kind of negative stigma associated with cycling, but also the positive stigma associated with cars, that is definitely prevalent on the island. But as you said, I've kind of listed off a number of barriers that I've identified maybe are not there. But again, that's like such an opportunity to capitalize on that, and I think I'm looking forward to the next couple of years with this project, because again, it's for Bonaire by Bonaire, and I think now that we're beginning to have some data, we can start to bring it to those in decision-making seats to start arguing our points, but I'm looking forward to it.
Your final question, Ushma, or?
Yes, I have one.
Yeah.
Yes, I have one question. You can maybe add on if you want to. But I just want to ask, if a city was truly going to embrace housing as a concept, which with all of its complexities, what do you think would it look like?
I think the health in all policies philosophy or kind of outlook, I think, is a good start. And I think getting health related actions into policies that are in other sectors like housing and transport, it may not be done overnight, but at least providing space and consideration for the health implications of policy decisions in other sectors outside of health is something that would be a great start, or at least the beginning of what kind of a city embracing healthy excuse me, might look like. But as we were talking about earlier in the car context, but also kind of generally as well, like allowing for or developing systems or infrastructures or groups that allow for this collaboration of health and housing and transport and these different sectors in local government to actually happen, is something that I think it has to be in a city that is embracing healthing as a topic. This to allow for that cross-sectoral communication and collaboration to happen. Whereas in a lot of cities that might not be the case now.
Okay, great. Thank you.
Thank
And,
you so much, Dylan.
Yeah, thank you very much both for the lovely talk.
Yeah, and
Thank you.
yeah, thank you very much.
Healthing Podcast. We'll explore how to make healthing easy and accessible for everybody.
Healthing is for you. Join us.